So we have been required we have been required to draw an AR diagram using Chen's database notation while stating the relationship between the identified entities, including their cardinalities and any relevant attributes. So, basing on this diagram, first of all, you have to note that in Chen's database notation, the stronger entities are represented by a rectangular shape. So if you look at the diagram that has been provided to us, we have stronger the entities are basically basically the core objects of the system, like patients data, malaria cases, and health facilities. So in our diagram, those will be represented by a rectangular shape. Uh, as seen here, the stronger entities like epidermal data, geographical location, treatment outcomes are represented by a rectangular shape. And then we go. So the diamond shape is they're basically called the relationships. Meaning, if you want to connect malaria type to malaria cases, you have to put the diamonds in between the two entities. So treatment outcomes will result into laboratory tests, whatever they have treated you, whatever they have tested you for. The outcome of your treatment will depend on laboratory tests. Also, entities like malaria cases can have health facilities or referrals undergo patients that are basically relationship or interaction between the entities. And then we have the oval shape, which represent the characteristics or the relationship between the entities. Like under resources, we have the resource ID, obviously, we have the quantity, we have the facility ID. These are things that are under the entity, a bigger entity. The basic characteristics of a particular entity. Like under laboratory tests, we have test type, test results, and test date, test ID. Under referrals, we have the case ID, we have the reason, we have who you're referred from, or the referral date. And then we notice in our diagram that we also have some green rectangular shape. These are basically weaker entities that cannot exist without the main entities. So for you to classify malaria cases by region, you need malaria cases first. For you to have laboratory test views, you need a laboratory test first. Just like for you to have patients data, you need the individual patient. For you to have patient view, you need the individual patient's data. So that's basically the ER diagram using Chen's notation.